The most common causes of rectal bleeding are really simple things, in the sense, as in non-malignant causes of rectal bleeding are more common. And these would be things like hemorrhoids, very, very, very common. You can also have trauma to the back passage resulting in a split in the back passage called a fissure, can also cause rectal bleeding. And then as you go further into the bowel, you can have things in the rectum and sigmoid that bleed, such as polyps. Very common in the UK and in Scotland in particular are diverticular disease. They can also cause rectal bleeding. And of course, sinister growths in the rectum and sigmoid colon, the bit of the bowel just above the rectum, can also cause rectal bleeding. Yes, it can be a sign of something serious, absolutely, because if you have a cancer in your rectum or your sigmoid colon, it can give you bleeding. Um, so it can definitely be a sign of something serious. The reassuring thing is that the vast majority of rectal bleeding causes, however, are benign. If you have new rectal bleeding, I would suggest you should see a doctor. Um, the only scenario where you would not maybe see a doctor was if you were absolutely categorically sure that you had a fissure, as in a split, a painful split in your back passage, and you bled from that, or you had hemorrhoids and you were bleeding from the hemorrhoids. So bright red, fresh rectal bleeding typically is coming from the anus, or what we call anorectal bleeding. But beyond that, it is certainly safer if you have new onset, new unexplained rectal bleeding to see your GP. So the first thing you do is you find out what any symptoms do with the bleeding. So if you passed a constipated stool, so the first test, as it were, is your own story of how you actually came to bleeding rectally. Beyond that, the things that you can do to establish the cause of rectal bleeding, which is kind of obvious, is to examine the back passage, have a look at it, have a look at the outside of the obvious external hemorrhoids. And then the next thing is to do an internal examination to look for any obvious abnormalities in the anal canal or the lower rectum that could have caused the bleeding. And also the color of the bowel motions within the rectum, because if there's fresh blood on that, you know, there's still active bleeding. Whereas if the stool color is normal, then you know the bleeding has stopped at the moment. Beyond your clinical examination at your GP's practice, or if you come to the clinic where we would see you, would then be to examine the rectum with a telescope of some sort to have a look within the rectum. Either a sigmoidoscopy, which examines the if you like, the first 10 to 12 inches of the large bowel from your back passage inwards, or a colonoscopy, which examines the entirety of the large bowel. So if the cause of your bleeding is something like hemorrhoids, then we can ban the hemorrhoids endoscopically at the time of your assessment. We can also remove them surgically if they're external hemorrhoids that stick out, for example. If the cause is something like fissures, then we can give you creams to help the fissures to heal up. And if the cause is something like diverticular disease, then these tend to be self-limiting and come and go. One of the common causes of bleeding, actually, or that makes you prone to bleeding, is that many patients in the UK and in Scotland certainly are on tablets like aspirin, rivaroxaban, clopidogrel. These are things you take for your heart, typically to keep your blood thin, but they make you more prone to bleeding. So sometimes if your bleeding is particularly pronounced and we know that it's a benign cause for it, then we discuss with your GP and cardiologist about whether or not you should be on a different tablet or change a tablet. And that can help stop bleeding as well.